Close your eyes and imagine a hospital room with dark lighting, beeping coming from different machines, and as you look, you see your loved one laying in the bed hopeless and gasping for air. You can't help but wonder if they're suffering or not. You've heard them say many times before, please just end it. I don't want you to see me this way. Hi, I'm Kaya, and I'm going to talk to you about physician-assisted suicide and why I believe it should be legal. The facts about PSA is that it can be voluntary, involuntary, active, or passive. Voluntary is when a patient gives you verbal consent or the physician verbal consent to give lethal drugs that will end their life in a timely manner. Involuntary is when a patient is more incapacitated, so they're not allowed to speak for themselves. Active is when a physician is actively included in assisting a patient with suicide, like writing a prescription that's going to administer that lethal dose. Passive is more of a natural euthanasia, kind of like stopping treatment for a patient instead of trying to do everything you can to save them. The practice of PSA and euthanasia is still being practiced in the Netherlands. It's been practiced there since the 1900s, and many people or patients in the Netherlands often carry a do not euthanize card because physicians, they euthanize in the Netherlands, whether people want it or not. But I believe that all patients should have a choice whether they want to be euthanized or not, or be assisted to their death. I think it's more of the terminally ill patients that we should be concerned with. Most terminally ill patients, they're in a lot of pain. They're given pain meds, but no one wants to be on pain meds forever when it's not even going to really heal or help their pain. Working in the medical field, I see a lot of patients with pain and mostly terminal illnesses that can't be treated or that can only be managed by their pain meds. It's heartbreaking to see, but some patients, they don't want to be the one that's stuck on pain meds for the rest of their life. I hear veterans that were in wars say they don't want to live anymore. It's just they want to go out with dignity. And that leads me to my next point. Patients want to go out with dignity. They want to be dignified. They've lived a long life. They've done a lot of things. Going out slowly and being in pain. And the one thing that mostly gets patients or patient family members more upset is towards the end when they're gasping for air. That's the more heartbreaking thing to see families go through, because there's nothing anyone can do to help them. The end is nearer than they think. I think that when patients aren't able to have that option to have physician-assisted suicide, they get a little bit upset with themselves and upset with the world because there's nothing they can do to help prevent them from dying or to help speed up the process. They're pretty much stuck. And being stuck is not fun. I believe physician-assisted suicide should be legal because it gives patients the option to choose what they want to happen to them in the end. They don't often get to choose a lot of stuff in the world, but I think their life is something they should be able to choose, whether they want to continue to live or not. Thank you for listening to my speech.